Concerns rising as flu season moves in, but parents aren't just worried about the flu and COVID. RSV cases are also on the rise. We are joined now by Dr. Sarah Coombs, an emergency medicine physician at Children's National. Doctor, thank you so much for joining us tonight.
Thank you for having me.
So, Dr. Coombs, hospitals across the country have been reporting this rise in RSV, something that typically peaks in the winter months. Can you just kind of break down for us what exactly is RSV and why do you feel that it is spiking right now?
Sure. So RSV stands for respiratory syncytial virus. Basically, it's one of the many common fall and winter viruses. So to give you a sense, almost everyone will have contracted RSV at some point before the age of 2 years old. So it is very, very common. And in general, for a lot of people, it will cause a cold. So a bit of a sniffle, a cough. In some vulnerable children, especially the younger infants, it causes a condition called bronchiolitis. Essentially, this is inflammation of those small branching airways. And that's when the babies potentially get into trouble breathing and come to see us here in DC at Children's National in the emergency department. In terms of why it's on the rise right now, it's interesting. We actually saw the same pattern last year where we all of a sudden in the summer were seeing very high numbers of RSV, and for some reason that's been repeating this year. We're not sure if it's this effect of having been locked down for COVID and thus having much fewer viruses and much less of a viral exposure. And thus now with back to school, basically ever since those late summer months, we have just seen this huge uptick that seems to still be rising in RSV cases.
Yeah, and it's very confusing for parents because, it hits the respiratory tract. It very much looks like a cold symptoms. You don't know if it's COVID. You don't know if it's the flu, you don't know if it's RSV. What are some things that parents can look out for? Because I actually have a family member right now. He's 18 months old, and he had to go to the emergency room because he had trouble breathing, and they had to give him oxygen. So, what can parents kind of look out for to rule out if this is in fact RSV?
First off, I'm so sorry for your family member. I hope he's doing better and on the mend. And exactly as you point out, it is difficult for parents. And I am a parent of young children as well as a pediatric emergency doctor, so I completely understand. What I would say with RSV is if it's causing mild symptoms, then it's okay. I don't like to fearmonger amongst parents. I don't want to get everyone alarmed. So for a number of children, especially toddlers, school-age children who are a little heartier, it might just cause a sniffle and maybe a day or two of increased cough, as long as they are able to be at home and to eat well, take in fluids, to breathe okay. You can keep that child at home. Don't send them to school or mingle with other children. What you're looking for in terms of if you're worried about the child coming into the emergency department is really trouble with breathing. So the things with that you're looking at is the child struggling? Are they using their belly muscles, their ribs? Are they sucking in and out with every breath, using those muscles to breathe? Right. Or are they even turning bluish or dusky? And then another thing would be often when children get trouble with breathing, their oral intake goes down. They're so stuffed up they can't take in fluids. So if you notice, especially for a baby, that they are just not taking the bottle or not breastfeeding, and all of a sudden you notice it's been 4 to 6 hours or more and there's been no wet diaper, that would definitely be a sign to come on into the emergency department.
Oh, I have so many more questions, but unfortunately we are out of time. We so appreciate your expertise. Maybe I'll hit you up for those questions and we can post it on our website or something. But Dr. Sarah Coombs, thank you so much for your expertise.
Thank you for having me.